All right. So hello, everyone. Thank you so much for joining us on this webinar today. So we are just waiting for a few more candidates to join in. Meanwhile, we'll just start off with a quick introduction. Thank you so much, Shadi and Suhani, for joining us. So I will just quickly start off with our introduction and then I'll introduce you and you can take it over. So once again, hello, everyone. My name is Sina. I'm the CEO, Senior Counselor for UniEd.Ventures. UniEd.Ventures is based in UAE, Dubai. However, we do take care of the GCC regions like Qatar, Bahrain, Doha, Oman, Kuwait, and other parts of the
علي
country.
صوت الزفت.
So we mainly, I would really appreciate if every one of you could stay on mute so that without any disturbance, we could continue this webinar. We will surely keep 10 minutes Q&A at the end so that in case you have any questions, any doubts, we can clarify them towards the end of the session. So again, just letting you know, UniEd.Ventures is based in the UAE, Dubai, and we help with your overall admission guidance to medical universities across Europe and UK. So if you're looking on for medicine universities in an affordable budget and which are accredited, globally approved, surely we will give you an option. Today, we are in touch with a very good university, which is UMCH, which is based in Germany, Hamburg. And it is one of the first medical universities having their program taught completely in English. You all might be knowing how daunting and difficult it is to get a medical admission in Germany, specifically because of the language requirements. And also you need to do a pre-med in Germany before you get into the MD program. However, with UMCH Germany, it could be an easier way to get into medicine in Germany. So furthermore, of course, the representative of the university will talk about and will give you a more brief idea about how it works and how UMCH can fulfill your dream of becoming a doctor in Germany. Now, having said that, in case you need any assistance further with your applications, documentations, visa, any kind of test prep support like IELTS, SAT, UCAT, which are required for medicine admissions, feel free to get in touch with our team and we will make sure to help you at each step. And that is the specialty of UniEd.Ventures, that we give you a very personalized streamlined approach in your medical school journey so that at every step you are quite well informed and we guide you. Now I'll be introducing the representative of UMCH, Ms. Shadi Heidarlou. Shadi is the partner manager for UMCH, and she'll be talking today and giving you an idea about the university and requirements and other details. Also, we have with us a very special guest, Ms. Suhani, who is a third-year student who has taken out her time today in her busy schedule to give you an idea about her experience in UMCH Germany. So thank you so much, Shadi and Suhani, for giving us your time today and giving some information to our students and parents. And we really, really welcome you and we want you to take over and start the session today.
Thank you very much for the introduction, Sina, and also for the organizing this event today. Hello, everyone. My name is Shadi. As Sina said, I'm partner manager at the university UMCH. So today I'm going to brief you about the university profile and also talk about the study structure and study program here. And we have here our lovely students, Suhani, with us. She's going to answer also your questions and also give some of her experiences. But what I would like to say from the beginning, Suhani is going to be with us for the next 40 minutes. So, Sina, because of that, I will directly start with the presentation, but maybe in the mid half of the time, we will just stop with the presentation so Suhani can tell a bit about her experiences and also answer the questions from your students, prospective students. So after that, we can continue with the presentation since she has, of course, a meeting afterwards as well at the university. So that's
Surely.
my idea, what I would say, what to do.
Surely, Shadi, we can do that in between, like wherever you feel that Suhani should
Yes,
pitch in and talk about, we can do that. And meanwhile, if anyone has a
perfect.
specific question for Suhani, I would really appreciate, please do put it in your chat box so that we can take up some questions in between.
Perfect. So, great. In that case, we will start with the presentation. You all can see my screen, right, Sina?
Yes, we can.
Perfect. So, first of all, I would like to say about the agenda for today. So, firstly, we will talk about the university profile and then go through study concept and also the student life and campus life here. Of course, we will also have a look on admission procedure. And we are also offering preparatory courses. I will also give you some details about that. And as I said, at the end, we have time to talk about your questions. So this pic, what you're seeing right now is a pic from our mother campus, UMFST in Targu Mures in Romania. So the university UMFST is founded in 1945. It's a very well-known and old university. And over there we have more than 13,000 students. And actually this program, what we are offering now here at UMCH, they started with that 20 years ago. So it's a proven concept in a new location. And UMCH is the international branch of the UMFST. So our campus is in Hamburg, in the north part of Germany. It's the second largest city in Germany. And our campus is, a very high-tech campus, and we have a very big community from a lot of countries. So right now we have more than 50 nationalities here. So it's a very, welcoming and great campus here. So, few numbers about our campus. So, we are having 200 study places per academic year, and we are having just one intake, so to winter semester, which starts mid-end of September. Right now, we do have 80,000 square meter teaching and learning areas. This number is increasing. Soon we will have 10,000 square meter, and we are having more than 30 German and international teaching hospitals, but we will talk about them also a few slides later. And as I said, we have a lot of nationalities here right now, more than 50 nationalities. To give you an idea how our campus is looking and also Hamburg, I'm going to show you a video, so enjoy.
Welcome to UMCH in Hamburg, Germany, a hub of academic excellence and innovation. At UMCH, we offer a dynamic academic environment with engaging lessons, interactive workshops, and a variety of events designed to enhance your learning experience. It's impossible not to make friends and broaden your horizons. With over 800 students from 40 nations, you are now part of a big family. The degree program, which is taught in English, is accompanied by free German courses on campus. These will prepare you perfectly for life in Germany and the practical phases in one of the German teaching hospitals. Over 30 teaching hospitals in Germany and Europe provide hands-on training, ensuring our students gain practical skills alongside theoretical knowledge. From the 3rd year to the 6th year, you will also immerse yourself in the practical phases and quickly gain practical experience that will bring you closer to your dream. Equipped with the latest technology, our campus supports cutting-edge research and advanced learning, featuring modern labs, simulation centers, and digital classrooms. Through our Reach Higher program, we empower students to achieve their full potential, offering mentorship and career guidance. And here's a message to you, dear parents. We would also like to invite you to attend exciting Reach Higher lectures at our campus. Our event team will be happy to talk to you. With our FEM Club, Female Empowered in Medicine, we are delighted to invite strong women with their expertise to campus and welcome them. UMFST UMCH Days bring together students, faculty, and industry leaders for a series of inspiring talks, workshops, and networking opportunities. Did you know that you can choose your teaching hospital from the 2nd year onwards? At the UMFST UMCH Days, many medical directors and doctors will introduce themselves to you personally. This makes us unique, and you can expand your network. We are honored to host high-ranked guests and experts from around the world, providing our students with unique insights and perspectives. Located in the heart of Hamburg, Our campus offers easy access to the city's renowned landmarks, vibrant neighborhoods, and a thriving cultural scene. Look forward to the second largest city in Germany. Life in Hamburg is safe, very idyllic, and you'll find something to suit every taste and hobby. Insider tip: Hamburg has its own beach, and the Baltic Sea and North Sea are only 1 to 2 hours away. You live in a region where many people like to go on holiday. Join us at UMCH, where your journey to excellence begins. Discover, learn, and grow with us in one of Europe's most livable cities. We look forward to meeting you. Welcome to UMCH.
So, and also the location of our university has a strategical meaning. So most of you know probably Silicon Valley. Of course, this is not comparable for that, but in Hamburg we do have a science city. It's a hub for research centers and a lot of companies, and also we are located in the middle of this place, and also University Hamburg is having their campuses. Daisy, which is the biggest or the largest research center in Europe, is just next to us. So it is directly in the middle of Science City. And it's very easily accessible by the public transport. You can reach the city center from here within 20 to 25 minutes. The bus station is just in front of our building, and you can use the public transport here in Germany and also here in Hamburg very well. So, one of the most important things, the international recognition. So, our degree is fully automatically recognized within the European Union, which means also here in Germany. So, if some of you are interested to stay here or to continue their career path first here, your degree is automatically recognized. Except that also we are listed in the World Directory of Medical Schools, which means our students are eligible for USMLE if they want to go to USA or to Canada. So this means there are a lot of opportunities for you in case you're interested to stay here. And also other countries like Norway, Switzerland, in these countries, our degree is also automatically recognized. So in Hamburg, actually, at UMCH, we started in 2019. So which means last year we had our first pioneers from UMCH graduation year. So 74 students who successfully completed their studies, and all of them are having their medical license, or they started also with their specialization training. And also some of them started with their PhD. If you are interested to see some examples on our website, you find on the page success stories and careers. So there you can see from our alumni who are talking about their experiences after their graduation. So few advantages, as Sina already said, in some countries and also here in Germany, it's really hard to get a place for medical studies, and also all the requirements are quite high. So I would like to highlight some advantages from us. So the program is fully in English, and we were the first university in Germany who are offering English medical programs. So that means at the start, when you apply for our university, there is no German skills required. And also we don't require any MCAT or pre-medical degrees. So you can directly apply with your high school diploma or with your predicted grades to start your study here in Germany. And we are having a very practice-oriented study program. We will talk about that also in the future slides. But as I told you, we have a lot of huge German and also international teaching hospitals. And except that, our practical part is quite high. So our students are having clinical years from third year onwards. So they are going to be in teaching hospitals during 4 years. So this is a great opportunity as well. And also, the specialization here in Germany is very great. So if someone wants to continue here and do their specialization in Germany, they can freely choose what they would like to do, and they don't need to do any exams. And actually, during the specialization training, the students are getting salaries. So this salary is, it depends on where you do it and also which specialization, but the average is between 65,000 to 85,000 euros per year. So this is a great salary to live here. And of course, when you succeed and you got your specialization, the salary is going to be much higher than during the specialization training. So I would like to talk also about the study structure. So, as I said, the program is for 6 years and it's fully in English. So, the first 2 years are preclinical years, which means these time the students are going to have just theoretical learning on campus and they have to do some internships. And from the third year onwards, it's going to be a combination of theoretical learning and bedside teaching in our teaching hospitals. So this is a great opportunity for students because they will have these practical experiences for 4 years. And the study structure is modular structured, which means every year has 2 semesters and every semester has 4 modules. And what we believe is that small group learning is a great opportunity, and this is also our approach here at our university. So the lab lessons at the university are going to be maximum with 20 students. So this is a different approach if you have 100 or 400 people or just 20 people. So there is a different bonding with the professors. There is also what we experience is a higher participation at the lab lessons because students are also feeling comfortable asking questions or actively participating. And also that we are doing a great job with the guidance for our students. We are offering private consultation hours, educational coaching. So we are taking care about our students. Here, actually, I would like to also ask Suhani to talk about her experiences with that. Your experiences with small group learnings and also with the hospitality, what you experienced here. Maybe you can give your experiences about that.
Yes, certainly. So my experience with the small group learning, this is something I really appreciate, and it was one of my reasons that I joined this university also. Um, the good thing about having smaller groups in one class is that the professors, they start knowing you personally. And for example, me, I like being asked a lot of questions. That's how I get focus in the class. So the professors know this, and then they constantly keep asking me questions. And some of my other colleagues have different ways of learning, so they tend to twist and turn themselves in order for us to learn and grasp the knowledge quickly. And we also built a relationship with our professors, which is professional, of course, but also a bit friendly, because that's how we as students feel comfortable to even ask and approach the professors to ask questions. The professors who taught me in my first year still remember me, my name, and every time we cross by, they even say hello, which is really good. And another thing is that if in our practical classes, each student gets its individual working station, so nobody is working in groups. Of course, sometimes if we have to, but everyone gets their own equipment, so you're not sharing. You learn with your own equipment, you do your own experiments, so it helps you even in the exams because exams are not gonna be crap. And another thing is about how we all students, we start having a little family of our own within the class. We can help each other out and do group projects together. Um, so this is something I enjoy, and it makes learning even fun.
Yeah. And that's also what we experience here. It's so nice to hear that learning makes also fun, but also what we believe is it's more effective. So yes, here you can see, so the students are going to have all from the first year until the sixth year, always theoretical lessons. And as I said, from the third year onwards, they will have bedside teaching at our teaching hospitals. I told you that they have to do also some internship. These internships are 4-week internships per year. And actually, these internships can be done also abroad. So if someone wants to go back to their home country to visit their family and friends, you could use that time to do your internship plus to visit the family and friends. The only requirement is that these hospitals can fulfill our requirements, what the students needs to do during that time. If they are fulfilling that, you're open to do it also somewhere else. And after the 6th year, there will be a final exam, and students needs to prepare a research paper. And yeah, and hopefully after that they will succeed and get their graduation. So, as I said, there is no German skills required at the start, but you need to get your B2 level until the third year. Since you're going to the teaching hospitals and you need to be able to communicate with the patients, B2 level is required. So for that, our students are going to have German lessons here at our campus. We have German teachers here, and you will have twice or 3 times a week German lessons, which are also integrated in the curriculum, so that students can get that level. In case if someone is interested to continue after B2 level, they can continue until the C1 level. Because if someone wants to stay here in Germany and continue their specialization, for example, here, they need to have minimum C1 level. So that's the reason why we also offer this C1 level for our students in case they are interested to. So about our teaching hospitals, this is a very unique part of our university. So as I said, we have more than 30 teaching hospitals here in Germany and also in other European countries. And the very unique part is our students are choosing which teaching hospital they would like to go. So in the second year of their study, we are organizing an event where the representatives of the teaching hospitals coming to the university. And after these events, students are doing a choice list of 5 preferred teaching hospitals. And actually, over the last years, we made it possible to send our students to their first or second choice. So this is a very unique approach because normally universities are sending the students to their hospitals, and here it's the opposite. And as I said, they will be there for 4 years. So why am I highlighting it? So this is also a great opportunity to open some new doors if someone is interested. Because if you go to a teaching hospital for 4 years and if you perform very well there and get a good relationship, what can happen is what we also experience right now is that our students are getting directly an offer during their study within the 4th or 5th year, so that they can directly start after their graduation with their specialization in that hospital.
Yeah.
So in with that, I want to give you also the opportunity to talk about that. She is going to start with her clinical part soon. And also, Sina, from here, I would say we will make a shortcut because in 20 minutes, Suhani needs to leave. So maybe if someone has any questions to Suhani especially. They should ask their questions so she can answer them.
Yeah, I'll start with telling you how I got my teaching hospital so you can get an idea for yourself and also share the experience of certain seniors whom I know, and they shared their experience also with me. So, what happens is that in your second year at the university, we'll have all the hospitals that we're partnered with come to our university and have a university fair called the UMFST days. What happens here is that all the universities, all the hospitals that they come, you can ask them one-on-one questions about the hospital, about the what specializations they have, and also questions about the accommodation. Some hospitals have Indian doctors, some Arabs, so you can choose according to your needs, even according to location. So the hospital I am going to have a lot of Arab doctors. The CEO himself is from Dubai, who was raised in Dubai, and then now he's a doctor in Germany, which is a really good thing. And that's the reason I chose that hospital. And then there are some students who have our seniors who were in the sixth year and graduated. They used to be in these teaching hospitals, and because of the good performance, they got job offers with when they were in the fourth and the fifth year itself. And then now those students are teaching our students as well as while they are doing their residency, which is such a proud moment for our university also to learn from our seniors because students teach students a bit better. So this is how I chose my hospital. So when you are choosing your hospital, also you can ask questions directly with them when they come here.
So I will maybe pass a few questions to you. So how would you describe the German course in the term of ease of learning? So I guess this is a question better to you.
That is a very good question. I was gonna mention that before. So I had completed my German level till C1 before I came into this university, but I have friends who didn't even know how to say hello in German when they came here. And then now, and in the beginning, I used to translate all their papers and documents, and right now they're going around speaking only in German. They took the German courses from the university itself, and the difference that I found with private coaching of German language and the university is that our university, they teach based on the medical terms. We learn the medical terms. They also teach not only the theory part in German, but they focus on the communication. They teach you how to communicate with the patients and also the fellow doctors and staff in German language, how you can ask the patient to take the anamnesis, and they also play lots of games. They go outside. We have something called the tandem program as well, where fellow students help the other students to learn German better. So this practical part of learning German language makes it even more fun to learn and easier. So these students, they have passed their exams also. They studied here, and then now they are going into the teaching hospital with a good German level. Yeah.
So do you want to maybe talk a bit also about other experiences, what you have here, where you think like it's nice to share that with the students, prospective students?
So I'm assuming most of you guys are from India or some Asian countries. We have something called the South Asian Society, which is called the SAS Club. Now, the SAS Club, what we do here is that there are a lot of South Asians coming together. It's not only South Asians, but even people from Africa, America, Australia. So what we do is that we come together and we celebrate festivals. We go outside for potlucks, we go dinners, we do karaoke night, movie nights. Recently, they all watched a nice Bollywood movie together at the university. So this is how we build friendships and keep our culture alive at the university, and also be a part of each other's cultures. We also celebrate Eid and many other festivals together. And this is a good way to even make friends. We have different other clubs like the music club, the dance club, We have the neuroscience club, which is quite new to our university. We have different neurologists and neurosurgeons coming to our university to share their experience as doctors, um, which is a really good thing. Yeah.
Would you also maybe share a bit also about living here in Hamburg, or in Germany? How
Yeah.
do you feel about it and how you are enjoying it here?
At first, it was, of course, a big cultural change to come here, especially from an Arab country where it's always hot over there now. And Hamburg, it's such a beautiful city to see so many internationals here. And it is also one of the most beautiful cities in Germany. It is quite open, and we have the port, which is one of my favorite destinations. And the good thing is the transport system is really nice. So from the university, it just takes 30-40 minutes to travel to the main city. So during your breaks, you can come and go. And it's good to make a lot of friends here. About the safety, I know many of the female students might be concerned about the safety here, but I would say Hamburg is quite safe. There's students, like female students, even traveling in the night after 8, and they have no complaints about anything, perhaps. Uh, we all go together for partyings, so it's okay, I would say.
Okay.
I had a question about the girls' accommodation.
Yeah.
We don't have a specific accommodation of our university, but our university is partnered with different housing agencies, which you can go under the UMCH accommodation list and see. I myself live in one of the accommodations called I Live or Urban Living, and all these agencies that were partnered with are studio apartments, and it is fully furnished. So when you arrive to Hamburg, you wouldn't have to go around buying something extra like furniture. You only have to come with your clothes. Um, there are grocery stores just below the building, so you can go and buy your groceries. And another best thing is that these agencies that we're partnered with are just 10-15 minutes away from our university with direct bus contact or direct transport. So you just have to take a bus, and the Urban Living and Duffus are the nearest. And it takes me just 10 minutes to go to the university. You can wake up late.
Excuse
All
me.
right. Yes.
You can please drop in your questions if possible in the chat box. We can definitely answer it.
I put the questions
Sure.
in the chat box. No one answered
Sure, no
until
worry.
now.
Actually, we have got a lot of questions. Please, you can continue.
This mean myself?
Yes, you can ask your questions, please.
Yeah, I just want to know the cost of living, then tuition fee. Is there a scholarship will be provided for 90% those who scored in CBSE? Then just last one, sorry. For example, learning medicine in German language, would it be so difficult or frustrated? How it could be after learning the German language, like until C1? Is it possible to complete medicine in German language?
Uh, this is a tough question. I don't know because I have no idea about that. But our program is not in German, it's in English. So the students, they just need to have the German skills until the third year. So that's for the clinical part, so that they will be able to go to the teaching hospitals to communicate with the patients. But their theoretical lessons, their lectures, and the exams are going to be in English. So there is no need to be worried about that. And about the tuition fees, we will talk about that. I just stopped the presentation because Suhani is leaving soon, and I just wanted to know if anybody has a special question to the students. But I will come back to your question about the tuition fee because we will talk about that also during the presentation.
Thank you,
I see a
Shadi.
question.
Yes,
You're welcome.
I
I
would
see a
also like
question
to,
about
yeah.
USMLE
Uh,
licensing
special
exams.
I would
I can
really
ask,
request
please.
everyone to please put your questions on the chat box because we have a very limited time. We would definitely get back to all your questions one by one because we have kept last 10 to 15 minutes for the Q&A. Since Suhani is a student who has joined and taken out very like her important time, so we would like her to talk about her experience and then we would take all your questions. So everyone, please stay patient. We will definitely answer all your questions at the end of this presentation. So, Hani, please continue.
Yeah, I see there's a question about the USMLE and if our university helps prepare for the USMLE exams. So it doesn't directly prepare, but we have lots of students from the 6th year and from the different years of our university who have already given if there are 3 steps, they have given the first 2 steps already and now they're working on the third one. So what these students do, we have a WhatsApp group where we all share if we need any help, or we also those students even arrange meetings with the American agency who help particularly for students who want to give USMLE exams and also help us prepare them. So if you come here at our university, you will get help and assistance for your licensing exam practice as well.
Sina, do you
A
think there
practical
is
question,
anything
if I
else?
can ask for the stage actually. Is the course NMC compliant? Would the child be future permitted for India course?
Yes.
This is also a question what we are going to talk afterwards. I just want to make sure, are there any questions, especially about what you would like to ask our students? So in that case, please feel free to ask because in 10 minutes she will leave us.
Sure, we have a very, very interesting question from Jafar. So, Hani, do you get Indian food near the hostel?
That's such a nice question. Honestly, I have a tiffin service. It's called Urban Tiffin of Hamburg, and they are Indians, of course, and they give me tiffin every day. I think it's like 10 euros max, and most of the Indian students from our university are taking this tiffin service. They provide food every single day, and the quantity is really nice too. Otherwise, we have Mensa, which is called the canteen at our university, which also provides food for a really nice cost. And they're quite healthy also. I don't think they're Indian food at the university, but
Sometimes we do have.
sometimes
Actually,
we
I
have
had
curries.
yesterday
Really?
chicken masala thing, something similar
Okay.
like this.
There is
So
a very special request.
Okay,
Is the food halal? Is the food halal for the Muslims?
at the university, yes.
yes, we do have twice a week halal food, but except that every day there is a vegan option. So in that case, they will always have an option. But also twice a week, they will also have halal meat. So they have always an option. And we are also having wraps and bowls, which are also vegetarian or vegan. So they will always have something to eat.
Yeah, the wraps and bowls are my favorite. But of course, even there are Indian restaurants nearby, even the Stefan service that we students take at our university are also halal. And there are many other halal restaurants nearby where you can order food from.
Thanks, Sohani. Any other question to Sohani? What board did you do? Did you do A level? So, Sohani, if you could give brief idea about your profile.
Well, I studied in Delhi Public School in Doha, Qatar, and it was CBSE, not A-levels.
Okay, you were a CBSE student. There are a lot of questions about if CBSE students need NEET, which is a mandatory exam from the Indian board. So I'm sure, Shadi, you will talk about it for the
Yes,
CBSE
exactly.
students.
We will talk about that.
It is a
Yes.
necessity. Any which ways, we'll just wrap up questions for Suhani first. If completed 6 years with UMCH, they are eligible as doctor, as junior doctors, and is internship included?
Well, internship you have to do, as I said, they are every year an internship what you need be done. So these are for 4 weeks, but except that during the clinical rotation, during these 4 years, you will go to the teaching hospital and go through different departments. Actually, we will talk about that, and I will show you also a video about that, since I stopped the presentation to give room for Suhani and the questions to her. But I will show you also a video and also an idea how this rotation would look like.
Yeah.
Sure. And any other questions for Suhani? If there is specifically anyone, you can please put. Suhani, why did you choose this university? If you want to say something.
The first reason was, of course, these smaller rooms and lesser number of students, because that helps me feel more comfortable in being open in the class and discussing my questions and also gaining knowledge. Another thing was, and the biggest reason was that in this university, we start our the internship, I would say, the clinical rotations from the third year onwards. Now, for me, I'm a third year student. I'll be starting my rotations from this Monday, so I'm really excited for it. And what happens is that when you start young, when you are this just in your third year and you're starting going for your clinical rotations, you tend to gain a lot of practical experience from the very beginning. There are students that in the same hospital that we as third year students are going, in that same hospital, the students from a German hospital who has finished his or her MBBS or like 5 years, 6 years, then they come. So, you start being into the practical phase with your seniors who have much more experience, much more knowledge. And then when you are surrounded with people like this, you tend to you push yourself forward, and it becomes a challenge for you to do better, to become a better doctor. There are many doctors who tell me that they don't remember what they studied in their med school, because for 4 or 5 years in India also, we have in our Indian education of medicine, you study for 5 years or 4 years straight for theory, and then you uh, go for your internship at the last year, right? But for me, I don't find that it doesn't make sense to me, because why study theory for like so many years and then go for your internship? Here we study few subjects. For example, I'll give you we for 7 weeks or 2 months we study 3 subjects, say dermatology, ENT, and orthopedics, and then literally 2 days later you go to the hospital and you're put into these 3 specialties. So then whatever theory knowledge you learned at the university, you go to the hospital and directly implement your knowledge there. So this way you're gaining experience, you're remembering things, and then when you come back, you give your exam. We have OSCEs starting from the third year onwards, so you know how to give your exams and you're much more serious about it. So then you give your exam, so okay, this is how I approach. And even we have subjects like doctor-patient communication, we have ethics, we have these subjects which are not taught in other universities. It's very rare to have such subjects taught. And because we're being taught so young, we tend to think like doctors and be more sensitive towards topics like death and how to give sad news to the patients. These are very sensitive and not and I think it is really important that we learn this. And another reason was because it is in English. And this allows me, now, of course, 6 years I'm gonna spend in this hospital in Hamburg, in this university, and also in my teaching hospital. I'll get an idea if I want to continue being a doctor in Germany, but it also gives me doors open for different countries. Like I can give my USMLE and go to America. If I want to go back to Qatar, I can do that too, or India. So it opens lots of doors for me to go to. And another reason was, there's so many reasons. Like I can't list one.
So, Hani, a lot of people are asking about scholarship. How do you get any scholarship?
We do not. Nah,
There is not.
unfortunately, we do not have any scholarships at our university. So yeah. But let me just note down the last reason so I don't forget. It was the state exam. So in other universities, like in German universities, if you go and study there, at the end of the year, when you finish your medicine degree, then you will have to give a state exam. However, from our university, because it's so integrated and our system is really it's certified, we do not have to give a state exam at the end. So because we're already doing an internship and everything, our exams, and then once I graduate from my last graduation exam and the graduation thesis, I can directly go to the hospital and apply to start my residency. So I do not have to study anything extra for the state exam like the other students do. And of course, because I already have a lot of experience from the third year to the sixth year that I went for the clinical rotations, and then I have learned German language. And also of course, we're studying in English, so I know English. At the same time, I also have the German knowledge. So it also puts you like a priority for the hospitals to see your CV that, whoa, okay, these are the things you have done, and it makes you a priority. There are so many students who graduated this year and they had already gotten their job offers when they were in the fourth and the fifth year. I don't think this is so rare to get a job offer so early, even before you complete your MBBS degree. So these were my reasons.
Of course, Sohani. And Sohani, also someone wants to know if a student has the same chance to work as a doctor from, unlike like you graduate from any other government university in Germany. So is it like similar? Since you mentioned that state exam is exempted for UMCH students, without writing the exam, they can get into the jobs. So is there any difference, or is it the same like passing out from a government university in Germany?
In that case, maybe I answer this
Yeah.
question. So there is no difference. It's just the way how we teach and how we approach is different. So, and as Suhani said, in the public universities, there are this state exam, and except that there is another exam as well, which called Physicum. And these two exams are very, very difficult. The Physicum exam is about 2 years, and the state exam is about whole 6 years. So we have a lot of, what I can tell you is we have a lot of students who are asking for a transfer since they didn't make it at the public or state universities here in Germany, and they would like to continue here. But regarding applying for the medical license, it doesn't matter if you come from here or from a state university.
Yeah.
Great.
So
Great. I think that answers the question. We have many questions, and I would really appreciate
yes,
people
we
to
will go
please
through all that later on.
later on.
I just wanted to say thank you a lot, Suhani, for your time and for sharing your experiences with us.
My pleasure.
Really,
And
really appreciate.
I'm already wishing you a lot of fun at the teaching hospital.
Thank you so much. I'm hoping to see most of these students at our university next year, or hopefully this year also. So good luck everyone with your exams, and thank you for having me today. If there's any other questions, I would love to answer them
Yes.
privately.
I will pass it also to Suhani in case there are some questions to her so she can answer that. Thank you, Suhani.
Thank you.
Take
Thank you
care.
so much, Sohani, for your time. Have a lovely day.
You too.
So perfect. In that case, I will share my screen again so
Yes,
we
it's
can
better we
continue.
cover all the points of tuition fees, scholarship, and everything,
Exactly,
so that
exactly.
all the questions will be covered in the presentation, and then definitely we will take questions at the end of the. We still have time, so
Exactly.
over to you.
So I'm just searching for my screen. So I hope you can see.
Yes.
Perfect. All right. Yeah, we were talking about the teaching hospitals. So during that time at the teaching hospitals, students are going through different departments. So they will gain insights into 30 medical disciplines. And as I told you before, you can do your internships abroad. But if someone is interested to do it here at the teaching hospitals, for example, this is also open to the students. And from our side, there will be a quality management which guarantees that our students are going to have a perfect training at the clinical teaching hospitals. And we have a lot of them. Here you can see, for example, a few of them. If someone is interested to check and see more details about the teaching hospitals, you can have a look on them on our website. You can go through the map and you will see a lot of details about the teaching hospitals. And yeah, there are also some other teaching hospitals in Europe, for example, in Spain, Malta, and in Lithuania. The only difference is there. If you want to go, for example, for your clinical part to Spain, you need to have this B2 level in Spanish, the same like what you need to do here at in Germany. It's the same for Spain. But we are not offering any Spanish language courses here. So this is then on the responsibility of the students. So they have to take care of that by themselves. About this time at the clinical part. So it's a block structured system. So it means when you have lectures or theoretical learning, you will be in full time on our campus. And if you go to the teaching hospital, you will be there in full time. So this is also highlight because you're going to experience a daily life at hospital, and you will go through whole the day. For example, some universities they are having lectures in the morning, and in the afternoon they send the students to the hospital. And to be honest, in the afternoon, it's not maybe that interesting part of a day because in the morning there are the visits or surgeries, and there are a lot of more interactions with the patients. And in the afternoon, it's mostly the paperwork. Of course, if there are any emergencies, doctors are going to do also surgeries and so on. But we believe that the students should experience the whole day. So that's the reason why they will be there in full time. And here you can see the gray part is actually the theoretical learning. So in the third year, the gray part is still quite high. So they will have more theoretical learning on campus, and they will be away for the clinical part for almost a month. But from the fourth year onwards, these parts are getting higher. So it's going to be 50-50. So half of the time students are going to be on campus having theoretical lessons, and half of the time they will be in teaching hospitals. And as I said, during that time, they will have a clinical rotation. As you see here, they are going through different departments. This is just an example. But yeah, they will get insights about 30 different clinical departments. Actually, here I will show you a video so you can have an idea how a day looks like. So enjoy.
Hi, I'm Urushi. I'm Kiara, and we're going to take you along to show our daily routines here at Elizabeth Hospital in Essen.
Welcome at Elizabeth Hospital, Essen's first hospital, which is a leading medical centre in the heart of the city. The Green Metropolis offers a fascinating mix of industrial history and modern urbanity. Located there, the UMCH Teaching Hospital provides medical technical expertise. It has more than 500 beds and offers inpatient and outpatient medical treatment at the highest level. Our UMCH students begin their service by accompanying the head physician, senior physician, and assistant physicians on patient rounds on the Barbara ward. Here they learn firsthand how medical care is provided in hospital and how diagnoses are made. The students then take part in a sonography course to learn the basics of sonographic examination of the abdomen and thyroid gland. This practical knowledge enables them to carry out ultrasound examinations independently. In PBL feedback sessions, our students present cases and discuss them with senior consultant Dr. Martin Wambach and visceral surgery specialist Dr. Lisa Feld. These interactive sessions are an excellent opportunity to deepen medical and surgical semiology. In the in-house cafeteria, students can choose from a variety of dishes every day and discuss the new information they have learned while eating together. Dr. Dakak, Senior Consultant in Internal Medicine and Gastroenterology, teaches our students how to make diagnoses based on patient symptoms. Dr. Thomas Schmitz, Head Physician at the Clinic for Cardiology and Angiology, demonstrates and teaches the students how to insert a TRAVI in the cardiac catheterization laboratory. In the newly designed library, our students meet Mrs. Anita Becker from the Practical Year office. She is the main point of contact for all administrative tasks and questions relating to the practical year. Professor Dr. Oliver Bruder, Chief Physician of the Clinic for Cardiology and Angiology and Medical Director, is a dedicated teaching hospital coordinator for UMCH, where he has already given lectures as a guest lecturer at Reach Higher events.
Hi, my name is Oliver Bruder. I'm head of the Department of Cardiology and Medical Director of Elisabeth Krankenhaus in Essen. We're teaching hospital for many, many years, and now it's a really great pleasure and honor to be part of the UMCH family, to continue our teaching success, our teaching story on an international level. So we are really glad to have you here at our hospital to make great doctors of you.
This was an insight into the exciting everyday life of our UMCH students at the Elizabeth Hospital in Essen. Together, we are training the next generation of doctors and offering them the opportunity to gain practical experience in a first-class medical environment.
Yes, so this was an example about that. So I could also a few words about academic research. Of course, also at our university, we are encouraging our students when they are interested to do some researches. And also our namesake, George Emil Pallada, was a pioneer in cell biology. So it's also a very big topic for us here. We have some main research areas like cancer research and neurosciences, but every student who is interested to do academic research are welcome to get in touch with the professors. So our professors will assist them and give them guidance how to do it. So, and we are also organizing, research days, so where we prepare our students to do any academic researches. So about the student life, campus life. So the study begins here in late September, as I said, and also during the time we are organizing a lot of events to make it very smooth for our students. So we are organizing welcome days to give them the possibility to meet fellow students and also have the possibility to talk with the students from like Sohani, for example, our student ambassadors, who could give them some tips and also all the information what they need. And also we are organizing like game nights or study survival guides. So everything for students that they don't feel like, okay, they are alone or they don't know how to, get through the first time in abroad. So this is what we are trying to do, that everybody knows to ask and also to get at least support or assistance from our side or from our students. So we
Sorry,
are also having.
Shadi, if we could go on eligibility criteria and fees, because a lot of students and a lot of parents are
Okay.
asking that. So, and we are short in time,
All
it's
right.
already 6. So if you can, really sorry
Okay.
about
All
that.
right.
We are
Yes, we
short in
will do
time.
that.
If we can just, get on to the application requirements and the tuition fee.
Yes. All right. So the tuition fees are for the students from European countries or UK or Switzerland, 14,900 per semester. For all other countries, 17,400 per semester, so twice a year. And there are 2 one-time fees, which are 595 application fee. But all of you who joined this webinar today are going to have an application fee waiver. For these, please reach out to Sina. She's going to give you the code. And otherwise, there is one-time and fee, 4,500 enrollment fee. So all these fees are covering all the administration from our side, the infrastructure, clinical training, and also the teaching by the lectures. So 17,400 probably for most of you per semester, so twice a year. And one thing which I would like to say here is also for the first year, the students needs to pay whole fees, so almost 35,000. But from the second year onwards, students can pay per semester. So admission procedure, Sina, probably I'm just going to pass because this is something what you can also help them through that. About the requirements from our side, it's depending on what kind of high school diplomas you have. But for example, for IB diploma, you need to have minimum 24 points, which you need also to pass IB successfully, and 12 points on higher levels. There is no specific requirements regarding the subjects or grades. By American curriculum, when you have your high school diploma or general education, educational development, we need SAT or ACT or APT additionally. When you do your British curriculum, we need minimum, this one is actually not right, minimum 2 A levels, 3 is not actual anymore. So if you do your 2 A levels, you are also eligible to apply for the university. And there is also no specific requirements regarding the subjects again. I know a lot of you asked about NEET. So about NEET, if you do your Indian curriculum high school diploma, you need also to have NEET exam. And we need minimum 144 score. So this is what is required. I know most of you, if someone is going to be interested, in May, the NEET exam is going to take part. But this timeline might be a bit too late for starting with your application. So what you can do is just the registration for the NEET exam would be enough to start for the application. Plus that you can also start with your visa process. And afterwards, once you did your NEET and you got your score, you can just submit it. But I will definitely recommend you to start with your application before, because afterwards it's going to be too tight. And since we do have just 200 student places and we have a rolling system, so first come, first serve, it will be good to secure your place.
Sure, Shadi. And one question is entrance exam, do they have to give? Yes, they do. Please, if you can
Yeah.
talk about that.
Yes, of course. Since we passed all the slides, so yes, the admission procedure is very simple. You have to create a profile on our student application platform, and you have to upload your some documents. So these are high school diploma or predicted grades, a CV, a motivation letter, and a copy of passport or ID. And once they are reviewed and everything is fine, you're going to have an entrance exam. This entrance exam is in 2 parts. The written part is 75 multiple choice questions, 25 in chemistry, 25 in biology, and 25 in general knowledge. And the oral part is 20-minute interview where the students talk about their motivation, why they would like to study medicine, and actually also to understand their English proficiency if they are able to study 6-year English medical program. Once you did your entrance exam, within 2 to 3 days, you will get an answer. When you pass, you will receive your study contract. And just in case you don't pass the entrance exam, you can still repeat it several times. So there is no need to be worried about the entrance exam. So these questions in biology and chemistry are based on school subjects, so that's going to be fine. And also, both of these parts are going to count together. So let's say, for example, if somebody didn't make it well during the written part, during the interview, they can do better, so they will count together, and then they will pass the entrance exam.
Sure, Shadi, and I would recommend everyone to start early so that they have enough time for visa process, because German visa process does take time. So a lot of people are asking when we should apply. I would suggest they should apply now. We are here, UniEd.Ventures. You can take our details on the screen. Please contact us. We will help you, like Shadi mentioned, with the application fee waiver. We will help you with all the documents that are needed and do your application on your behalf. And furthermore, we will help you to book the exam with UMCH. So there are multiple dates every month, and we will give you the dates. And whichever date is suitable and convenient for your child, your child can write the exam online, followed by a short interview. And once the child gets accepted, you will be shared the offer letter with the deadline dates. And as soon as you get offer letter, it is recommended to pay the first year tuition fee and get started with a visa. So furthermore, we are here to assist you. Kindly register on the details here on the QR code, or send us your email ID in the chat box. We will get in touch with you, or please do get in touch with us post this webinar so that we can help you with the entire procedure.
So what I can tell you is you're in very good hands with Sina. She's going to help you a lot during that process. And even if somebody still has questions or open topics, just reach out to Sina. We can always organize a one-on-one session together. And actually, I will be also in Dubai soon. So if someone wants, we can also organize an on-site event. So Sina is happy to organize that. So reach out to her if someone is interested to meet me there, so we can talk about your questions, go through the open topics. So I'm happy to be there for you as well. And as she said, we have twice a month our admission tests. But even if someone can't make it by the set dates, we are happy to organize individual appointments. Just reach out to Sina, tell her your suitable dates, and we are happy to organize an individual appointment for you.
Absolutely. Thank you so much, Shadi. We do have a lot of questions in the chat. If you have another 10 minutes, we can quickly take a few questions. I don't want to point, but I'm really sorry we don't have so much time. I might skip some questions, but I do assure you that if you reach out to me on my WhatsApp, I try to respond as quick as possible. So if you reach out to me on my WhatsApp and you have any specific question or you need any clarity, feel free to reach out. I'll be more than happy to guide you. Also, as Shadi mentioned before, I forget, she'll be in Dubai on the 30th of January. And you can let me know if you are available to meet her. We will surely conduct a small event and you can join us. So you can definitely get in touch with us, and we can definitely get you an in-person meeting with Ms. Shadi so that you can in detail discuss your queries with her. All right. So Shadi, I'll just quickly take some questions. Okay, ma'am, any specific percentile requirement for CBSE grade 12 board exam? So is there any specific grades required for CBSE or A levels or any other grades?
As I said, by A levels, there are 2 A levels, no specific grades and no specific subjects, just 2 A levels. By CBC, you need plus the NEED exam, and by NEED exam, you have to have the score minimum 144 points. IB successfully passed IB, so 24 total points and 12 points on higher level subjects. Yeah. And if there are any specific diplomas, just reach out to Zena, tell her what kind of curriculum you did, and we are happy to check that and give you an answer. But I can tell you, in the most cases, there are not any specific grades or subject requirements by the diplomas.
Sure, Shadi. And what about non-Indian curriculum high school diplomas? Do they still require NEET? Or is it only for
Well,
CBS?
what kind of, for example, what kind of curriculum do they?
I mean, I don't understand by non-Indian curriculum, but maybe talking about British curriculum or American curriculum.
Yeah, in British curriculum, 2 A levels. By American curriculum, they need to have SAT or ACT or APT additionally to the high school diploma. Yeah.
So specifically, NEET would be only required by CBSE students.
Right.
All right.
Exactly.
Thank you.
Excuse me, can I have only one last question?
Sure, please, ma'am.
As you said, if the child appears for entrance exam, okay, if she scores 80%, if she scores 90%, what basis you will be providing the scholarship?
There is no scholarships, unfortunately. So
Unfortunately.
it doesn't matter what kind of grades they have. Unfortunately, there is no scholarships.
All right. Thank you, Shadi. Any more questions you can please put in the chat box, ma'am. We would definitely be happy to assist you. IELTS is not needed.
I also have a question.
Please,
Can
can you please put the question in the chat box? I will definitely
Yeah, I
take it.
put it. I have put it twice, but I didn't.
Okay, I'm sorry. Maybe it got skipped. Yes, please tell us.
I was asking. Okay, A level. I think so. You don't for A level results. You don't need A's, only entrance exam. Entrance exam you need to
Okay,
give.
so as I as I understood, Shadi, the question is only the entrance exam required to get in UMCH, no matter what the grades are in their A levels?
I mean, it doesn't matter what kind of high school diploma everybody has. The entrance exam is required to do. So you have to do the entrance exam from our side to be able to get accepted here.
Sure. So the deciding factor would be the entrance exam and not the grades, what they have already received. Since there are a lot of curriculums, so that is the reason the university has kept their own entrance and interview as a benchmark to get into their medicine program.
Hi there. This is Engineer Summer speaking. I'm looking for the medical university for my daughter in this 2026 September intake. Is that the university is registered with the Sri Lankan Medical Council? Because if we want to do the practice in Sri Lanka, the university must have registered with the Sri Lankan Medical Council. So could you please confirm this?
Yeah, I am not sure about that. This I need to check. I can, when I have the answer, I can pass that to Sina so she can get in touch with you. So I'm just taking a note on that.
Sure. And I'm sure a lot of parents will have questions regarding their countries. So parents, please get in touch with me. I will surely make sure to get back to you regarding the answers, because right now, since we are short in time, the webinar time has already passed 15 minutes. It was a 1-hour session, but the response has been really amazing. And I'm overwhelmed with the students and their questions and the webinar, how it's going. And I do assure you that I'll try my best to get answers to you. Right now, we will just answer a few more questions. So if you have any questions, just put in your chats. I'll note them down and I'll make sure I'll get back to you. So
same question regarding NMC compliance for India.
Sure. So I believe, Shadi, we already discussed in the first slide that the degree is accredited and approved throughout the world when it comes to India, UAE, GMC, NMC. So if you want to talk about the approval or accreditation again, Shadi, please, you can talk about it.
Yes, as I said, the degree is automatically recognized within the European countries and also like in Norway, Switzerland, and UK. And since we are also listed in the World Directory of Medical Schools, students are also eligible for the USMLE. For practicing in US or in Canada. For specific countries, I'm not sure. So because of that, as Sina said, please reach out to her and tell her so we can check if students needs to do anything else when they go back to their countries. In India, what I can tell you is they have to do the exam FCMGE, I guess. So this exam needs to be done also over there. So when they go back, but about other specific countries, we need to have a look on that. So please reach out to her, tell her about the country. So I will check on that and let you know.
Thank you, Shadi. Some students have joined late and they're asking about fees and all. So I would surely share the recording of this webinar because we have already covered the fee, the academic requirements, if there is scholarship or no. So definitely please leave your email IDs here in the chat box and I will send you the whole recording of this webinar so that you can go through it if you have missed on anything. So is there any graduate
I
entry?
am also checking some questions here. So SAT, we already said, is required when you did your American high school diploma. IELTS is not required since there is no requirement regarding your language, so no TOEFL or other certificates. Since we are going to have an interview from our side, this is not needed.
Sure. Some parents are asking about if IELTS is required, IELTS, International English Language Testing System.
No, it's not required.
Okay. And fees is fixed for 6 years, right? The fees that you mentioned.
Exactly. It's fixed. So even if they increase, they are not going to be affected. So students are going to have the same fees.
Sure.
So I see there also, is there an age requirement? No, we do not have any age requirement. We have students who just graduated with 17, 18, or sometimes also some younger person. And actually this year we had our oldest student here at our university who started with 62 to study medicine. So the range is huge.
Sure. So it is not a benchmark that students have to be 18 as well. Even if they are under 18, like 17 crossing,
Exactly.
they can get into UMCH. That's not a problem.
Exactly. When the minor accept that
Can
and
I ask
give
one important question?
If you can please drop in the chat now, I can just take it. Your good name? Shams Khan.
No, I can
please
ask
drop it.
very quickly
Okay, sure.
one very important question.
Sure.
Yeah, as far as I know, in German university for medicine, the admission criteria is 3A level, and they are asking for more than 95% or 90% score in 12th grade. But why your criteria is just to pass? So in this case, did German hospitals giving value to the degree on same level as compared to the students passing from German public university?
I mean, it doesn't matter from which universities you pass, and our criterias are from Romania since our university is from there. So that's the reason why there is a big difference. So they come from there, and since our mother campus is there, so you're going to have these criterias, and I mean, it makes our it's more student friendly. So students who are dedicated to study medicine have a chance to start here. Except, I mean, it's not the same case when you go to the public universities here. I mean, also we have a lot of German students. It's not just about the international students. So the same for the German students. It's very difficult to get to the public universities here in Germany. So we have a lot of students who are asking for a place here because they couldn't get a place in the public universities because of their requirements.
Sure, Shadi. And I believe UMCH is quite welcoming in terms of talented students. So sometimes grades are
Exactly.
not the benchmark of a student's capability or a caliber. And since there are so many curriculums, so a university cannot decide based on grade from one curriculum, different curriculums, different study patterns. So the benchmark is the university entrance exam and interview, wherein they filter out the students for the university. So I would say that is also like a kind of a benchmark that university sets, and not just focuses on individual grades or set of grades on individual level.
Yeah, and sometimes what we experience is also students who didn't make very well during their school time are the excellent students here because they are really interested into medicine and are dedicated to become a doctor. So exactly what you said, the grades always not give a sign about the students how they are going to process here. So
Absolutely. So that makes me go on next question, which is quite repetitive about ICSE board. So some student wants to know what is the requirement for ICSE. It's also related to Indian board, like India has CBSE and ICSE. So it would be the same for India, or would you have to like double
I
check
have to
that?
check that. Just give me a second so I can check.
Sure, please do. We
Can
are
maybe ask other questions during that
sure.
time.
And I also have one repeated question here. So like someone wants, for those graduated from the university, are they allowed to work or not?
What do you mean? Like, are they when they are? I mean, the degree is recognized, so they can apply for the medical license, and then they can start to either. I mean, in Germany, you need to have a specialization. So afterwards, either you do directly your specialization, or some of the students they start with a PhD first. So it depends on that. Or if someone doesn't want to practice as a doctor but maybe go to the medical companies or pharmacy or whatever. Sometimes they took this career, but if you want to practice as a doctor, you need a specialization. So for that, you need to continue first with your study as well. And as I said, in Germany, during your specialization, you still get a salary and depends on your specialty, but it's the average is between 65,000 to 85,000 euros per year, what you're going to receive. So I just checked your question about the
Excuse me?
ICS. What was?
Excuse me. I have
Yes,
asked many
yes.
times, but I did not get a reply for
Sure.
the.
Yes, I
Sorry,
see
for
you
the
have
graduate.
repetitively asked a question. Is there
Yes,
graduate entry for those who have
graduate
bachelor's
entry
degree?
or
Yeah, sorry.
equivalency or something like
Sure.
that.
Shadi, if you can take that question, Miss Yasin is
Uh, yes. So what I wanted just to say, all Indian curriculum certificates like Indian school certificate, all India senior school certificate, higher secondary certificate, pre-university certificate, all of them still need to have additionally need exam.
Sure, Shadi. And we have noted that. And Shadi, just this question from Yasin, is there a graduate entry for those who have bachelor's degree?
Well, this program is integrated program. So since it's a 6 years, so it's bachelor plus master together. So it's an MBBS program.
So can they enter after doing their graduation to this medicine program 6 years?
Well, so you mean like transfer to our university?
No, someone who has graduated, like done like graduation in certain program, like mostly high school students get into the medicine. So, but if someone is a
Like
graduate,
my son is graduated in biotechnology. He has a degree of biotechnology already. So is there any equivalency to join the
Well,
university?
in that case, yes. This is always an individual decision from our dean. So maybe some of his credits are going to be accepted here. So what we always ask is please send to Sina the transcript of records and also syllabus from the previous university. So we will pass it to our dean and she's going to make the decision. So if some credits can be accepted.
absolutely. I will definitely send you the documents, Shadi, and your team can evaluate the documents. So if anyone
Yes.
any kind of needs some clarity on their requirements or getting in the university, we can surely check the eligibility criteria for them and they can start the application accordingly.
Actually, I'm seeing also a very interesting question about if for the practical is using simulators or using real cadavers. So we are doing both. We are using real cadavers plus the simulation, and also we are having this 3D anatomage desk here at our university, which is also a great thing. So not a lot of universities have it. Actually, in Germany, I guess there is just not a university who have that. So we are combining the traditional way with the modern way. So you are doing your practice here at the 3D anatomage tables. So with modern way, you can also undo what you did wrong. So this is not the case when you have your real cadavers. So you're practicing a lot. You're having great opportunities. But then we believe also in the traditional way. So you're also having real cadavers and you're working on them as well.
Thank you, Shadi. And moreover, University UMCH has tie-up with 30 German teaching hospitals. So when you make a connect with these hospitals, of course, you get the hands-on clinical training with cadavers and stimulators. And of course, for some of you who are asking, are they allowed to work in Germany or not? When you make a connection with German teaching hospitals, do your, internship and clinicals there, of course, you can work in Germany without having to write the state exam. Am I right, Shadi, on that?
Yes, since the degree is automatically recognized. Yes.
So I think that answers your question. Now let me check another question. What about the students required to get A's in high school level? As we discussed, Iqbal, there is not a very much requirement of getting triple A's or anything. The university entrance exam and interview will be what will be considered, not any specific grade levels. Okay.
And I'm seeing also some questions about the fees, if they are including also final exams or if there are any additional fees. No, there are no additional fees. Everything is fully covered with these fees.
All right. And hostel fee.
Can I ask a question?
Yes, sure, please.
Yeah, I would like to know, it was informed that after the MBBS, we had to do this specialization, or is it already included in the specialization? I mean to say that after completion of 6 years, can the student, after the completion, can directly start practicing, or is there any specialization required further? And
in Germany, yes.
Yeah, second question is that, is it possible to work after the, during this study, is it allowed to work in Germany part-time, like, during the study?
Yes.
To cover the
So
cost?
to your questions, so the first question, in Germany, if you want to work as a doctor, practice as a doctor, yes, you need to have a specialization. So for that, the reason what I said, after the general human medicine study, they need to do a specialization. And during the study, yes, students can work. Some of our students are working, for example, in restaurants or as a courier, or also students can also work at the university. For example, when we are having events or by organizations, so they can work also here. So yes, they are allowed to work, but of course not in full time. So and also, since the medicine degree is also a demanding degree, so I guess students will also not have a lot of time to go to work. So it's maximum 20 hours per week what they are allowed.
So the specialization is after completion of 6 years, the specialization has to be, okay.
Yes.
So this is how long, the specialization process?
Well, this depends on what they want to do. It depends on the subjects. For example, neurology might take longer than maybe something else. So, but I can tell the average is between 4 to 6 years.
Okay, so only after any person can join any hospital, or like they can do the practice there, is it?
Yes, but during this specialization, they will be mostly in the hospital, so they will practice already there. So that's the reason why also they get a salary. So.
Okay. So okay, I got it. Yeah.
Thank you.
Thank you.
Thank you.
You're welcome.
Shadi, if you can
But this is not a difference to our university. So even if they go to a public university here in Germany, after their study, they need to do their specialization, and it's the same career path.
Sure. Shadi, thank you so much. And really,
You're
we
welcome.
understand how many questions are just coming up, and we have so many more questions. So if you have another 5 minutes, can we take some more questions?
Sure, yes.
Thank you so much.
No worries.
I'll do
Take
my
your
best.
time. I still have time, so we can still continue.
you.
I will let you know.
Thank you, thank you. And I
You're
apologize to
welcome.
parents if we are not able to answer and skip, but I assure you that please do get in touch with me, and I'll make sure to get back to all your answers. Right now, we are just taking some questions which are popping up quite recurringly. So, average accommodation and living cost. A lot of people are asking if you can give an idea.
Yes. Well, of course, this is a difficult question. It depends on the personal standards of the person, but I would say the rent, as for example, at our cooperation partners, where the students are having fully furnished apartments, if they take like a studio apartment, the rent is between 700 to 800 euros per month. And if somebody is also cooking at home and not eating outside every time, so I would say 500 euro extra per month would be enough to have a proper life. So yeah, between 1,200 to 1,500.
Sure. Thank you, Shadi. And
You're welcome.
as a general consultant, can they work? I'm not sure this question, I'm not able to understand. Can they work as assistant or teacher or mentor during studies?
This is a question I don't really understand. Like, I mean, as a teacher, you can't work somewhere, or do they mean like as a
Maybe
mentoring here during their
part-time.
studies?
Part-time, maybe. Can they work as
Yeah, so as I said, working is okay, so they are allowed to work to until 20 hours per week during their study.
Okay.
And during their actually break or holiday, they are also allowed to work to 40 hours per week,
Okay, sure.
but just during the break time and holiday time.
Sure. And Shadi, we also have a question about ranking, why there is no QS ranking for UMCH.
I am not sure. This is something what I need to check, and I can let you know about that.
Sure. Please do let us know about the ranking, because some students are asking us. And about the visit visa, can the parents accompany students while they are studying or stay with them? Is it a possibility, or they would have to take a separate Schengen visa and then come and visit them accordingly?
Probably that's the case, but this is a question what they need to ask the embassy. I can't give an answer on that, but probably yes, they need to get a extra visa.
Nowadays, there are a lot of multi-entry visas as well. Visa updates are changing everyone, so we request the parents to check about how often they can go and visit their kids in UMCH. All right, and one more question is Shadi which we are getting repeatedly. Does the graduation happens in Germany or Romania, and why the fees is higher in Germany than Romania?
Yes, the graduation is going to be here, but the degree is going to be from the UMFST. And yes, the fees here are higher because, I mean, in Germany, we are also having higher prices. The infrastructure is higher, has a different cost, and also the teaching hospitals and everything else. So all around it has a much more costs. That's the reason why it costs more than in Romania.
All right, and they will be graduating in Germany if they are paying the German fees, right? All 6 years.
Well, they will, exactly. The graduation is going to be here, but the degree, what they are going to receive is be from the UMFST, from the mother campus.
All right, sure. Thank you. I hope you have got your answer, Olaf. All right. Romania cost, I believe you have, did you talk about the Romania cost if students want to transfer third year onwards to Romania, Shadi?
Yes, they can do that, but in that case, you should always have that on your mind. The teaching hospitals, what you're going to visit will be in Romania, so you need to have Romanian language skills for that. So that means that you have to learn the language by yourself, since we are not offering Romanian language school here or lessons here.
Sure. So,
but it's open to of course, it's open to the students. So if they want to continue from the third year onwards they can do that.
Sure. Shadi, regarding the living cost, was that 7,000 euro per month, or yearly it is approximately 12,000 euro, like for the living cost?
Yeah, 12,000 euro per year, yes.
Per year. Moreover, like even students need to make a blocked account wherein they need to keep 12,000 euro for the visa purposes. So every month they can withdraw some amount from that. So I believe that should be an average that students should look at for the living cost, apart from the
exactly.
And does the fees include books and all in that?
Yes, I mean the students are going to have a access to one of the biggest data platform, which are providing all the researches and a lot of books in medicine. It's called I don't remember the name. Just give me a second, so I will think about it. But our students are also having a platform, and they will get all their documents and all the books or scripts, what they need. It will be provided there, and we do have also a library here, so they can also borrow books if they want to have it right, like real books. But if someone prefer the digital form, it will be provided to them.
Sure.
The name is Elsevier Clinical Key. So this is also very known by the doctors, and the license costs a lot of money, and we are offering this license to our students.
All right, great.
Without any cost.
Sure. And on-campus accommodation is available or not? Shadi, you want to speak about that?
No, on campus not, but it's very close to our campus. We have a lot of cooperation partners. I can send you also a link, Sina. You can send it to your students. It's depending, of course, on which of them, but it's like between 15 minutes to 13 minutes to the campus.
All right, sure. So
and easily accessible by the bus.
Yes, and moreover, I would just like to add on that we would surely give you some links which have been given from the university side for accommodation, which are very safe and which are partner accommodation with the university. It's just 10 minutes from the university. So students can just take bikes and commute to the nearest possible accommodation wherever they select. So not to worry, it is not like they have on campus, but the accommodations are not very far for your kids.
Yes.
So I don't think there is anything to worry. Students need to pass any exam if they want to practice in the UAE. So Sana, every country has a different sort of protocol. So for every country, you have to check the country rules. Yes, there are different licensing exams. In UAE, you have DHA, and similarly, like in different parts. So every country, you will have to write the licensing exam. That is something, a country requirement. However, when it comes to accreditation, approval, as Shadi has already mentioned, it is accredited throughout world. It is listed in World Medical Directory. So when it comes to accreditation, you don't have to worry about it. But when it comes to your country specific requirement, if your country is putting any exam, that you will have to write, and you will have to check exactly what the country specifications are. So I believe I could help answer that question. All right. How about Arabic higher school? Is the student is in secondary MD in Syria? Can he be accepted, Shadi?
Let me check directly by the...
Sure. Meanwhile, I'll take some questions.
Yeah.
So yes, Wala, you're asking about ranking. Well, I have worked with this university for quite a while, so I might be able to give you a little bit of like knowledge about ranking, since UMCH is a new campus, like it's a 6 years old now. The first batch has passed out already. That's why the new campus might not have ranking mentioned in the QS. However, if you check the original mother campus ranking of Targu Mures, they do have a ranking. So I would suggest you to check that. And the reason for not having a ranking for UMCH is because it's a 6-year campus located in Hamburg, Germany. So usually rankings are given to the universities which are more than 10 years old at that particular location or site. So I believe that could be, but however, yes, as Shadi mentioned, she would get us more insight about ranking, and then we can give you more information on that.
So I checked from Saudi Arabia, for example, they just need to have general secondary education certificate. That's it. There is no other requirements. And I'm just seeing there is one comment. I guess maybe I said it wrongly, but a studio apartment costs 700 euro per month, not 7,000.
Yes, that's why I clarified that it's like yearly would go for like 12,
yeah,
7 to 12. Exactly. All right. So I see there are some more questions. Most of them we have already answered. Let me quickly check.
I'm checking how are the student breaks scheduled. So maybe this is also a question what I can answer. I'm not sure about the breaks during the day or if we are talking about holidays. But what I can tell you is every semester consists almost 14 weeks. So after 14 weeks, students are having a holiday. Of course, if they don't pass directly by the first try their exam, they do have opportunity to do it again after a few weeks. But other than that, there is a long holiday also during summertime, also during the Christmas time. So yeah, and during the day, the student breaks mostly in the noon time. Students are having a lunch break, and mostly students are having yeah, it's depending, of course, until 4 to 5 p.m. Some lessons. And on Friday, we are trying to not have a lot of lectures so that students can start their weekend earlier. So, yeah.
Sure. Thank you so much for that knowledge, Shadi. If they want to travel back to their home country, I'm not able to understand, Mohan, what that question means. If you can elaborate, please. Now I have 2-3 more important questions, Shadi, before we end this session. Any application deadline that students should keep in mind?
Well, we do not have a clear application deadline, but as we said, Sina and also me, if someone is sure that they would like to study medicine here at UMCH, I will definitely recommend to start with it as soon as possible. Firstly, to be able to start with visa application as well and all the other stuff, plus to secure the place. So it takes a bit time to get an appointment by the embassy and also prepare all the documents, because after your application, when you accept the study contract, you need to send us your hard copies, which are translated and notarized. So all these are taking time. So because of that, I would definitely recommend you to start with it as soon as possible. But I guess I would say the latest should be April, but I'm not sure about the country where you are from. So in some countries, it takes a while to get an appointment for visa. So yeah, please have that on your mind.
Absolutely, Shadi, even in our experience, because we have been supporting students for UMCH Germany now. Approximately 2-3 years, and we have seen in the region that it's little tricky to get an appointment with the embassy. So we always tell students to keep at least a buffer of 2 to 3 months. So it's always advisable you start your application early, book your exam, get the offer letter, and start off with your visa process as soon as possible. And do not delay till the deadline till April, then it could be a problem. If you're not able to get the visa, you won't be able to reach the university on time, which would cause an unnecessary delay and unnecessary hassle. So our advice is also to please start early. All right, I have shared my details and my contact details and all in the chat box here. For those of you who want to have a 101 with Miss Shadi or who want to meet her in person in Dubai, please get in touch with me. You can email me, WhatsApp me with any specific question that has not been answered or anything for clarity that you would need. Because UniEd.Ventures has worked with UMCH now, as I mentioned, for quite a while. We would be able to answer in detail your questions, and I would be more than glad to get you on a 101 session with Ms. Shadi so that you can clarify your doubts ahead. So kindly note down our details here, and you can follow us also on our social media platform. And for any upcoming events also, please join us on our website, and you will come to know more of the events that we do quite regularly with medical universities across UK and Europe. Okay, one important question. If a student fails in one subject, he has to appear to write the full semester again, or only failed subject has to be written again?
Now, just the failed subject needs to be written again. So, Sina, I just wanted to say thank you to you and to all the participants. Since we couldn't do whole the presentation and some slides were missing, so in case you still you are having questions or maybe some open topics, please reach out to Sina. I'm happy to organize this one-on-one session with you. And also, as I said, I will be there soon, 30th January. If someone is interested, we can also meet and talk about your topics and questions. Thank you again for organizing it,
Thank you so
Sina.
much, Shadi. Thank you so much.
And
Grace, I will answer your
thanks to everybody.
Thank you. I will answer all the questions later, Grace. I'm really sorry we have to sign off because we have been 48 minutes late. And Shadi, I'm really sorry about this delay. And I really apologize.
No worries.
But we tried our best.
I'm happy that everybody had so many questions and is so interested. So please reach out to her. We can continue that in a one-on-one session.
Absolutely, Shadi.
Thanks, everybody.
Thank you, Shadi. Have a lovely day ahead. Thank you so much for your time and all the knowledge and guidance you have given us today. Have a lovely day.
Thank you again. Bye-bye.
Bye-bye. All right, students. So I have again shared my details over here. Just in case you need to have a one-on-one session with me or Ms. Shadi, please feel free to get in touch with me. My WhatsApp number is here. You can just directly DM me and I'll be more than happy to answer your questions individually. Right now, I'm really sorry we would have to end this session because we are already delayed the webinar timing and I would have to sign off. So thank you again. And I wish you all a lovely evening and thank you for joining us for the session today. Have a lovely day. Bye-bye.